The rate of diabetes is soaring in Manitoba. New research from the Manitoba Centre for Health Policy looked at major diseases over the last 20 years, and in the last decade, it found a 46% increase in the number of Manitobans living with diabetes. With more on this, CTV's Jeff Keele joins us now live. Jeff, I take it this is a big concern.
Absolutely. The researchers say people are being diagnosed at a younger age and living longer with diabetes. More than a decade ago, Nikki Webb was shocked by her type 1 diabetes diagnosis.
You're otherwise young, healthy adult, and all of a sudden now there's a flick of a switch and your whole life changes.
Those changes included monitoring her insulin levels and what she ate.
It's kind of nonstop thinking about it. And now that I also have a child, I have to think about, how do I be safe to ensure that I'm, able to care for her.
Unfortunately, Webb is far from alone. Research from the Manitoba Centre for Health Policy shows between 2013 and 2023, there was a 46% increase in the number of Manitobans living with diabetes. And comparing the years 2015 to 2018 with 2020 to 2023, cases rose by 21%, representing more than 6,000 Manitobans who were newly diagnosed. The study says people are being diagnosed at a younger age and living longer with the disease.
It is certainly alarming. The number of people that we saw, we were able to identify over 150,000 individuals.
The belief is a poor diet, obesity, and a lack of physical activity are risk factors, as well as socioeconomic reasons like access to food for low-income people.
The social determinants of health are big factors, I think, in why we're seeing these increases in this condition.
But there were positive takeaways. Over the last 20 years, the rates of heart attacks, strokes, and nearly every major chronic disease declined, possibly linked to improved treatment, earlier diagnosis, and better prevention.
Like smoking cessation, that could be a factor where we see some decreases.
The researchers also point out while rates for many of these chronic diseases drop, the number of Manitobans living with these conditions is still rising because of population growth and the aging population.
So, Jeff, where did this research team get its information?
Yeah, the report says they analyzed what they call 110 health indicators like doctor and nurse practitioner visits to hospitalizations, procedures such as hip replacements and cataract surgeries, and tests such as CT scans and MRIs.